Thank you for taking the time to view this introductory video on cancer and genetic mutations. This video is produced by the Hong Kong Hereditary Breast Cancer Family Registry. The Hong Kong Hereditary Breast Cancer Family Registry is a non-governmental charitable organization dedicated to support the Hong Kong Hereditary High-Risk Breast and Ovarian Cancer Program, HRBCP, in providing free access to genetic screening and consultation for underprivileged and high-risk breast, ovarian, and prostate cancer patients and their families. The registry also collects data for research to enhance positive management outcome. Most people are probably familiar with breast and ovarian cancers. Breast cancer is the most common form of cancer affecting women in Hong Kong, while ovarian cancer ranks among the top 10 most common cancers affecting females. What you might not know is that a gene mutation can be inherited and increase the risk of cancer. The said mutations include BRCA1 and BRCA2, and rarer genes such as TP53, P10, and a few others. The diagnosis, treatment, and follow-up support for patients with these mutations can differ significantly from cancer patients without such inheritance. This video will inform you about what you should do if you suspect that you might have a hereditary mutation. How can you tell if you are a gene mutation carrier? Firstly, you might have a hereditary mutation if you have been diagnosed with breast cancer at or before the age of 45, even if you do not have family history of cancer. Secondly, all ovarian cancer patients are eligible to undergo genetic testing. Thirdly, a gene mutation is likely if there are breast, ovarian, or prostate cancers across 3 generations. Fourthly, it is also likely if you have been diagnosed with cancer in both breasts. Fifthly, a hereditary link is probable if you have been diagnosed with triple-negative breast cancer, which means your cancer is not hormone receptor positive and not HER2 receptor positive. And lastly, if a male member of your family has breast cancer, a hereditary factor is likely. If you fall within any of these 6 categories, there is more likely to be a gene mutation carrier. In that case, your doctor will likely refer you to our center, or you may contact our center directly. Upon referral, a member of our staff will contact you to confirm and verify your details. If preliminary inquiries confirm that you are at risk, arrangements will be made for you and your family to undergo genetic testing and to receive counseling. Whilst waiting to be tested, please ensure that all reports relating to your condition are at hand, including surgical and pathology reports. You may also be asked about your family's cancer history. Being prepared will help us better understand your risk. Indeed, that is why you are with us at our clinic now. But what exactly is genetic counseling and how might it help? A genetic counselor will explain BRCA1, BRCA2, TP53, and P10 gene mutations to you. But you should be aware that there are also other gene mutations which may cause hereditary cancer. Therefore, we will tailor-make appropriate genetic testing most suitable for you in accordance with your personal and family's medical history. A genetic counselor will also explain the implications of being diagnosed with a gene mutation and how this might affect you. For example, if you are diagnosed with a gene mutation, the inheritance rate is 50%. Therefore, there is a 50% chance that you have inherited the mutation from either of your parents, and you might also pass it on to your children. We will therefore advise that your first-degree relatives, including your parents, siblings, and adult children, to also receive genetic testing. You may also want to know how having a mutation might increase your chance of developing cancer. For example, with BRCA1 gene mutation, the likelihood of a woman developing breast cancer during her lifetime is close to 65%, and that of developing ovarian cancer could be as high as 40%. In men, the chances of developing prostate cancer and colon cancer will also increase. With BRCA2, the chance of a woman developing breast cancer may be as high as 40%, while that of developing ovarian cancer will be around 10%. In men, the chance of developing breast cancer will be 6%. Apart from breast, ovarian, prostate, and colon cancers, there is also an increased risk of developing pancreatic and bile duct carcinoma, skin cancer, gastric cancer, and cancer of the larynx. At the registry, we can provide an appropriate testing and treatment plan for you according to your risk profile, age, lifestyle, and family history. For breast screening, surveillance would include a mammogram, ultrasound, and breast MRI scan. If you already have breast cancer, you may need to have a regular blood test to check for tumor marker levels. For ovarian screening, surveillance may include a regular monitoring of tumor marker levels, pelvic examination, and ultrasound. For prevention of cancer, some women may consider risk-reducing mastectomy, prophylactic salpingo-oophorectomy, and use of medications to lower your cancer risk. Now that you understand the background of hereditary cancer, how is genetic testing performed? Testing is simple and involves a blood test. After completion of the test, please wait patiently for your results. When your report is ready, you will be contacted by telephone and invited to the center, where your report will be explained to you. When appropriate, a genetic counselor or surgeon will discuss with you the options for prevention and your treatment plan. In general, 3 different test results are possible, as follows: that there is a mutation which results in increased risk of cancer, that there is no mutation, and that there is a mutation which needs further investigation to confirm its associated risk. We will provide you with tailor-made management plan based on your test results in order to help you and your family prevent cancers and to improve the outcome. If you are a mutation carrier or further investigation of the mutation is necessary, we encourage you to discuss the matter with your family and encourage them to come forward for testing as well. Doctors will advise if or when they may need to have genetic testing and further examination. Knowing your status can help you and your family prevent cancer. In our experience, most patients who receive genetic counseling are able to deal with their results positively. However, if you or your family are troubled by the results, we can provide you with psychological services for support. Genes cannot be altered, but we can minimize the risk of developing cancer with testing, screening, and appropriate treatment. Over the years, we have helped many people with gene mutations. They can still enjoy good quality of life and build loving and happy families. Thank you for watching.